on this. Before we go on, let's have a word of prayer. Thank you, Lord, for allowing us to sleep and slumber on last night and get up on today with new mercies. And we ask you to shine your anointing and power upon us, that we may be powerful and impactful in this broadcast. God, we just thank you for the opportunity to get up on this morning and to share what needs to be shared. We give you thanks in Jesus' name. Amen.
Amen.
And we say a pleasant good
Amen.
morning.
Good morning, Bishop, and how are you?
Man, I'm doing well, sir. How about yourself?
Well, we can't complain, man. A nice day. It's starting out to be a nice day, but might get a little hot, but I can deal with it. Turn on the air and we'll just deal with it. And thank God for, good weather, and just thank God for being here.
Mm-hmm. Yes.
All right. Well, we'll start. Good morning, everyone. And every day we rise, it's a great day to be alive. And the Seven Cities Forums of Hampton Roads presents Portsmouth Coffee Talks morning show. I'm James Slim Overton, and I'm here with co-host Thomas the Colonel Chapman. And Leah had an engagement this morning, and she might tune in and she might not. She's a part of a program. This is a Teacher Appreciation Day.
That's
So
right.
she's taking part in that, probably for the alumni, I'm not sure. But anyway, she's taking part in that. So we might be missing her today, but we will represent her. But our special guest is guest host, Dr. Ernestine Duncan, and she is professor of psychology. You well know her at Norfolk State University. She's a frequent guest, and I always say this to other people, that they're running a second or a third or a fourth as far as appearances on this show to Dr. Duncan. She goes all the way back, so we appreciate her. But now her appearances will be more frequent because she is a host. We put guests in front of it because she's not here every Monday, but she is one of the hosts here on Portsmouth Coffee Talk. So good morning, Dr. Duncan.
Good morning. As always, it is my honor to be here this morning. I appreciate you all so much for allowing me this opportunity once again.
Yes, and thanks for getting up, and putting on your earrings. But anyway, Dr. Duncan is here for us, and we thought about let's do this. This is Mental Health Month, so we wanted to come on and have Dr. Duncan talk about the state of mental health. That's kind of a broad, but she'll break it down into different categories. But the state of mental health nationally and locally. And one of the subjects I think she can cover is about mass shootings. When people wonder about that, because we do have some politicians, Colonel, we do have some politicians that use that, well, they conveniently use it for every shooting to keep our attention off gun legislation. And some cases it might be, but it's not always the case. And Dr. Duncan is going to talk about that.
Yes.
Okay.
But first, before you,
that's right. Colonel.
The views stated on this program are the guests and the hosts, and no third-party affiliates. And so hopefully keep us out of Facebook jail. So you can continue. Just got to get that out of the way.
Thanks, Colonel. I appreciate you.
Thank you. Some people think that it is an increase in what we see with mental health, mental illness in this country. And clearly the statistics say that there is a crisis as it relates to mental health in this country. But I would venture to say even across the world. The United States seems to always be in the lead when it comes to situations like this. But I would venture to say, I'm not sure that we're seeing so much of an increase as much as we are seeing an increase in attention and awareness to what is going on. The Center for Disease Control, the CDC, did a study in 2021 asking Americans, did they think that the United States was in a mental health crisis? 90% said yes. So an overwhelming percentage of Americans feel that we are in a mental health crisis. That mental health crisis includes people feeling anxious, depression. These are the most common things that we see. Substance abuse, trauma, such as PTSD, post-traumatic stress disorder. And years ago, we used to think about PTSD as a disorder that was specific or most commonly seen with the military. However, more recently, we recognize that there's a significant number of people who experience trauma across the lifetime. When you think about neighborhoods where killing and shooting occurs, when you think about the mass shootings that are increasingly occurring in this country, people are experiencing traumatic events. Children are experiencing traumatic events, and it has lifelong effects, particularly if they are not addressed and if they are not treated. So the question is, are we in a mental health crisis? Yes. But another question I believe that has to be asked is that new? Or have we, since the pandemic, given more attention to conditions that have existed for a long time? I would venture to say, especially if you're talking about people of color, mental illness has been an issue for a long time, but because of the stigma associated with it, and because often we kept silent about it, we're only recently becoming aware of the statistics and the significance of how this is impacting our everyday lives.
Ernestine, I agree with you. And you mentioned PTSD. And we see a lot of, especially the young folks coming back from the battlefield, suffering from PTSD. And because you see these horrific battle wounds, there's death everywhere.
Yes.
And death doesn't count because, you have some 21-year-old, 18 to 21-year-old kid that is shooting everything that walks. And then they come back and then, your body parts everywhere. Then they come back to society here and have to reassimilate back into society in this peacetime army. And a lot of times they act out. And that PTSD is gone back, in another case, it's gone back into the family, and it affects the spouses and the kids and all that because they relive what happened on the battlefield. But if you fast forward and use it as a connective concept, we're seeing that in the civilian sector also, that PTSD, like the shootings down there in the open carry states like in Texas, where in the mall, those folks saw horrific deaths down there. The kids' heads, can't even tell the people's heads where they were or sex or whatever. I'm hearing stories of that. And then so those folks will have PTSD from those type of shootings. And we've gone to, in this country, is to desensitize it because it's so frequent now that we have mass shooting. Because already we've had 200 mass shootings, or mass shootings
This year.
Or more people shot. And that's classified as a mass shooting. Then we have days in the year. So saying that, and then you have a Confederate Party that doesn't want to do anything. So there's a connective piece to that. So my question would be, PTSD can be a disability, depending on how it is affect that person. When will Social Security get around and start giving folks Social Security disability when you're no longer cope in society? And that's when the right will probably open up because it costs them money. That's all they care about is money. They don't care about the people, they care about the money.
I'm sorry.
Yeah.
I couldn't agree with you more, right? One of the questions I heard you ask, though, was when will Social Security begin to acknowledge this as a disorder? And I'm reminded of an answer my mother used to give often, which was, you asking me? I wish I had the answer for that. But when you really think about anxiety disorder, when you think about PTSD from a psychological perspective, it is an anxiety disorder. It falls under the class, initially it fell under the class of anxiety disorders, which meant that when people experienced a traumatic event, because of what you referred to, the flashbacks, the reliving of the event, if you can imagine that you were in an environment where there was loss of life everywhere, and it was unpredictable, how anxious would that make you? Not knowing at any point if something could happen that would cost you your life. So it is very anxiety producing. And again, we talk about it, particularly in the literature, as it came about through the military. But we know now that children who live in homes where there's domestic violence can also experience PTSD. Women who've been sexually assaulted, PTSD. There is a limited body of literature, but a very interesting question about children who live in neighborhoods where there's a lot of violence and the kinds of things that they are exposed to. Anxiety. Think about, there are homes where people don't feel that they're protected from violence outside. Gunshots come into their homes. How do you sleep knowing that that's a possibility? So I think sometimes we underestimate the scope of how many people are living in environments where they experience anxiety that interferes with their ability to function on an everyday basis. We know that the powers that be make it very difficult for people to use mental illness as a disability. It's money, it's financial, but our country is built on that. Because if it were not, there would be more preventative measures that would be used not only for our mental health, but for our physical health. But those things are only slowly coming into our awareness, that there are things that we can do to prevent illness and to promote wellness. But we don't focus on those things. We'd rather people be sick, need medicines, need doctors, and if anyone is dealing with anything physical right now, what I hear, experiencing myself, we can't even get doctor's appointments. There are waiting lists because people are physically, mentally ill. I have a colleague, Dr. Jim Lassiter, his current and he's a psychologist, his current waiting list is August. And he sees 10 people a day. So there are limits to what we can do because of the state of the wellness or the lack of wellness, the illness of our community, our country. But our country is not built on wellness. It is built on the promotion of illness.
Excellent point. You also stated saying the feeling of people not being protected. People of color, I will state this, people of color understand that we live in a system, there are two justice systems. And if you're of color, you're not protected in this country. And they're showing that where you can walk up to the wrong door and get shot through the glass or through a door and almost get away with it, unless there was a ring or some video or whatever. Or you could be running in the state of Georgia, just jogging, and have two trucks pull up and do a modern day lynching by shooting you in the street. We are not protected as our white counterparts are in this country, which lends to a living PTSD. Because we have to do that, because our PTSD is if I get stopped by the cops, first thing is saying, am I going to live through this encounter with the police department?
An anxiety response.
Yes.
Right. And what we know happens with an anxiety response is that our bodies react physiologically.
Yes.
Very easily, we know our hearts race. There are a whole lot of things that our parasympathetic and our sympathetic nervous systems do because our body is then confronted with what we know to be a stressor.
Mhm.
And we experience stress because we don't feel like we have the resources to meet the demands of the stress.
Mhm.
And so our complete body responds. There is the release of hormones to prepare us for fight or flight, right? And again, those are things that, depending upon how you act on them, can get you behaviorally into an even more dangerous situation. We don't understand why many times the reports are that people are confronted by the police and they run. Everybody will say, why did they run? Well, there were things going on in their bodies that sometimes disconnected from their thinking, and they're just trying to flee. That is an adaptive response, to try to flee a stressor if you feel like you cannot meet the demands of it.
Mhm.
But I think it's that daily living in a constant state, and regardless to your demographic, your socioeconomic status, where you live, what community you are in, what state you in, we often are targets.
Mhm.
It may be targets for gun violence. It may be targets for prejudice, discrimination on our jobs, but nonetheless, there is a physiological response to that. And I believe that after years of that physiological response, our bodies often can't handle what we've lived through, the experiences that we've had. And as a result, we end up disproportionately with health risks, diseases, and increased mortality because we then cannot access the care that we need to be able. So we're at risk for these disorders, physical, emotional, psychological, and then we don't have the access to get the care that we need. And therefore, we die prematurely, or we have a quality of life that is less than it should be.
Mhm.
Dr. Duncan, if someone that we consider evil, you and I might consider evil, would they be considered mentally ill? And I ask that question because, the research is showing that a lot of these mass shootings, the perpetrators not necessarily mentally ill. And it's a thin line in trying to figure out if that's the case, or if they're not mentally ill, what are they? What is causing that? And when investigators approach that, should they approach that automatically that this person has to be mentally ill because he shot 8 people, or do they approach it in another way? But you get the whoever the politicians saying automatically they're making a diagnosis, and they have no no educational backing to even do that. But it helps their agenda, whatever. But I'm just asking that thin line. Studies show that it's most of the people that commit these things are not mentally ill. What are they? I mean, evil, like I said earlier, just evil or demonized or what?
So there are so many questions embedded in what you're asking,
Mhm.
and I appreciate all of them. I actually did some research, and it was interesting to me to find that actually the relationship between mental health and mass shootings is actually very weak.
Mm.
So in other words, the majority of individuals who commit mass shootings do not have a mental health diagnosis. I'm looking here for the number, but severe mental illness has been studied by professionals, researchers at Columbia University, the Department of Psychiatry. And what they find is that there is a very low relationship between mental illness and mass shootings. What they hold is that there's this psychological concept that we talk about called representation error. And what that means is, so for example, there are people who won't fly because they're afraid that there'll be a plane crash and they'll die. Well, the reality is there are significantly more automobile crashes than airplane crashes historically. However, the representation when there is an airplane crash is that the media and everything sensationalizes it. So we begin to think erroneously that it's more dangerous to fly than it is to drive.
And
Similarly,
go ahead.
Similarly, although there are hundreds of mass shootings, in fact, as the colonel said, 200 already this year, but the ones that get most media coverage are the ones in which people have a history of mental illness. And so then what is explaining the increase in mental illness? What is increasing the numbers that we see with mass shootings? And there are a lot of people who believe, and again, we'll go back to the disclaimer that these are the opinions of the people on the show. However, I believe that with the presidency of Donald Trump, who perpetuated and made representation of hatred, bigotry, and discrimination, it unleashed or reinforced that in people who were of the same mindset. And so now there are a cohort of people who feel privileged to act on that racism, that bigotry, that hatred. And so, whereas they used to try to be closeted about that, now they feel that it's open season. And while that's happening, there have also been sensationalized stories of those that are not held accountable and responsible for what they do. So if it is in my nature, or if it is that I'm that angry, that full of rage, feel that I didn't get a job because someone else got it due to an affirmative action, and so I act on that, and then I see that I get off with it, I get away with it, what negative consequence is there for the next person to do the same thing? And so it is just my opinion that this kind of thinking has been emboldened, and that then because there are no consequences that are lasting, that are serious, we then think that it's okay, and it perpetuates a cycle.
You know, I'm going to make that transition a little early so we won't have to stop. And I want to thank all the listeners. We have about 5 minutes, but I want to thank you in advance on WGPL 1350 AM for listening. And please join us next Monday morning at 6:30 AM. We appreciate you. I wanted to, you know, I always make these references to movies I've seen in the past.
Yes.
And sometimes I wonder about, you know, who's creating some of these things. I saw this movie when Michael Douglas was in, and he was just trying to go about his life during that day. And everywhere he went, he got bad treatment. You know, he went into a fast, food restaurant. He wanted to order breakfast, and they said breakfast just ended. He went somewhere else, and you know, he was just, I think it ended 5 minutes before it should have, and he just wanted breakfast, and he went somewhere else, and it kept happening. And the next day, you know, he comes back with a gun to all those places he went to. And I can't remember if he actually shot the people, but he scared, you know, the bejeebies out of them. And I just wonder if sometimes we, I mean, as people perpetuate some of the problems by our actions. You know, you deal with somebody that's already on the edge, and he comes to you and just wants regular service, and you are a-hole, you know. And then next thing you know, something triggers in him that he didn't intend to. He didn't start out that morning like some of the people, but then he ends up, it's been a crime of passion.
which is why I
We
think
all
it's,
responsible in some instances.
Mhm.
Mm.
And I think that's why it's so debatable when people talk about it's not the guns, it's the bad people. But if they didn't have access to the gun,
Mm.
then they would have to find another means to act out.
Mhm.
Some of the research that I did also talked about the fact that mass shootings are probably the least harmful in terms of people who want to hurt others. Those people that are serious about mass killings, they use bombs, they use fire, so when we talk about mass shooters, we are talking about a group of individuals who are not as lethal, not using the most lethal means. Yes, they do a great deal of damage, but when you look at the methods for mass killings, shooting is actually low
Mhm.
in the risk.
You set a building on fire full of patrons, something like that. Yeah.
Mhm, mhm.
Well,
I wanted to go back though, it also, it was multi-levels to your question.
Mhm.
Is that mental illness, right? So a lot of times we don't understand what mental illness is, right? And we talk about specific diagnoses that people have, but understand that the majority of people who experience these disorders are functional. There are people who are living with depression. There are people who are living with anxiety. There are people who are living and functioning, working every day with PTSD, schizophrenia, substance abuse. But we tend to look at severe mental illness or mental illness that is problematic when it interferes with the person's ability to function on a daily basis. So if my depression doesn't allow me to get up out of the bed on a daily basis, then my depression can be considered a more severe mental illness. If my anxiety doesn't allow me to go out and interact with people, we've all heard agoraphobia. If I can't go to work because of that, then I have a mental illness. So we talk about mental illness in multiple ways, but I think a very clear distinction is that mental illness is when people are functioning in a way that is distorted as a result of how we normally feel psychologically. When that feeling interferes with the person's ability to function on an everyday basis, we then are talking about diagnosable and possibly more severe mental illness.
mhm. Since you rewinded, I remember when you saying your colleague is seeing 10 patients a day. And I look at some of the professionals out in the military setting, they give 20-minute appointments. So the military, we just brush over it because you can't do anything in a 20-minute appointment other than say, we're going to talk about one thing and then make another appointment for you. And you better talk quickly because I got to get you out because that's what I'm mandated to do. And then the other piece is people may ask, why don't we have enough mental health providers? And it goes back to the numbers of years that it takes to train mental health folks.
Friends, brothers and sisters, ladies.
Because say for a psychiatrist, you got 4 years of college, another three to 4 years of med school, that's 7, and then you got a residency. And so that's 10 years of training. For a nurse practitioner, psych nurse practitioner, you've got 4 years of college and then another 3 years to get your DNP, that's 7, but you've also probably worked in the field 4 to 5 years before you went on to graduate school. So that's after your baccalaureate, or to get there, you've probably in the field about 10 years. And for a psychologist, it's about 11 years. And am I correct? 4 years.
You're correct. 4
grad.
years of college, 5 to 7 years for the doctorate, which includes an internship.
Yeah, so you're at the 10, 11, takes a decade. And so that's one reason, because, and then you pile up a lot of debt in the intern
Yes.
period. Yes, and that's another issue there. And so it's funny that we don't want to have debt relief now. At least the right doesn't want to have debt relief. So it compounds that problem as we look at why we don't have enough practitioners to take care of all our mental health folks.
Agreed. I think that you nailed it because it is a significant investment of our time. I jokingly say now, my daughter's 26 years old. And my friends that I went to high school with, their children are 30s, 40s. And as a result of me having my family later, right, because I was in school. So it's the time, right? It is the investment financially, which is why I say to anybody listening or to students that I encounter, go where they pay you. Okay, because right now, there is less than 1% of all psychologists who are African American, less than 1%. And so there are programs that are invested to training psychologists of color. Therefore, they will provide scholarships, stipends for you to live. But when you want to talk about the finances of it, people laugh. So I laugh. I did my pre-doctoral internship in Oklahoma City in 1999. No, that sounds like, and
like
my
Prince William.
salary for that internship was $12,000 a year. And I worked harder than I had ever worked. I worked roughly about 60 hours a week, made $12,000 a year. And it was a great sacrifice, not only for me, but for my family, because I had to move to Oklahoma City. And I was married with a daughter. And the way that we had to do it logistically was that I went alone. So my daughter went to live with her grandmother for a year, and my husband maintained the household in Atlanta for the year. So not only was it my sacrifice, it was the sacrifice of my family, to include my mother-in-law, who took care of my daughter for a year. So that is one of the reasons why. And then once we graduate, we're degreed, there's a licensure requirement. And that licensure requirement often includes a certain number of hours of supervised experience, over 2,000 generally. And then once you've accomplished that, manage healthcare. So many of my colleagues now don't even use insurance. And that's another issue that relates to access, because many of my colleagues say it's not worth it to me to do the level of paperwork that's required for one client and make $50 an hour, make $50 for that hour. So now they don't see patients who have insurance, or if they have insurance, they choose not to use it. And as you know, we refer to that as they pay out of pocket. But people often can't afford to pay out of pocket for a weekly appointment at $80 to $100 an hour. So there are a number of factors that contribute to the shortages that we see with opportunities for those who need help. Our community service boards provide it, but they're backed up even further than my colleague.
Wow, and that's amazing. And you get these college students coming into Norfolk State per se to Department of Psychology and majoring in that with the goals of being clinical psychologists. but somewhere down the line, they have to make a living coming out there, and it's probably they might probably make a little bit more than 12,000 now, but it's still the
Would hope so.
minimum compared to what they really can make and what it takes to survive.
And when
You have
yeah,
to pay to live, you have to, So I mean, how many? I'm sure y'all kind of track that. Students coming out of Norfolk State. It might be hard, but how many actually stay in the field after they leave that are psychology majors and
now
stay in
that's
some form or fashion?
right. That is probably our institutional research could give us some numbers about that if students,
Respond.
respond and follow up with us. I happen to know about some that I've had a closer relationship with. Often what we find, and this is just a small technicality, they stay in mental health or social services, but they leave psychology and go to social work. And one of the reasons for that is because with an MSW, a master's in social work, you can treat independently. You can have a practice. With a master's degree in psychology, you cannot. You cannot be licensed. For those who want to practice and not take insurance, they can practice. You hear a lot about coaching. These are the things then that the umbrella that people use. But I am proud to say in the 20 years that I've been at Norfolk State, there has been a significant increase in the numbers of students who actually go on to graduate training, either in psychology or social work or school counseling. We see the relationship between what they learn with us and then what they do ultimately. I think a conundrum here is that because psychology is the study of mental processes and behavior, it has broad applicability. And so I am always happy when our psychology students go to law school or go to medical school, because they have a basic foundation of how people think and how people behave, and they take that to the new discipline. So, in essence, I would say we see more students increasingly since 2000, going to graduate training. But that training is not always in psychology.
Did you have many come out of School of Psychology this past weekend?
We did. I'm a little bit more distance from it now, in that I'm in the ombud, the provost office, in the role of ombuds. But there were still some names that I recognize and some students that I have worked with through the Golden Key International Honor Society that are psychology majors. And that's why we're there. It's to see Saturday,
right?
All of the hard work and all of the family support that has put our students where they are, and their futures are bright. Life-changing can happen if you utilize your college years wisely.
Yeah, and the family has to realize that support doesn't stop at the graduate level. I mean, the undergrad level.
Exactly.
Especially if they've taken your route, they have to continue to support in any way they can.
Exactly.
You sent us one of the bullet points you sent us, and you might have talked about this in all the discussion you had today. What mental health issues are trending now? That was one of the bullet points, and it might have been incorporated in some of the things you already said, but can you address that?
Yes. Clearly, those things that we know, anxiety and depression, are at an all-time high since the pandemic, right? But again, I would caution people to really consider, are they higher than before, or are we normalizing them more? In other words, is it okay to say, I'm feeling anxious now in light of a pandemic, in light of the social injustice that we see? I pose it that people were experiencing this level of anxiety before the pandemic, but we just didn't talk about it. So in some ways, a good thing out of the pandemic has got us to focus on our psychological health. But clearly we see anxiety, we see depression, we see suicide. There's an increase in suicide. And I find it really interesting, particularly for our Black communities. There now is a reference and discussion about suicide by cop. That, in other words, particularly young Black men are not going to engage in the active act of taking their lives. They will not put a gun to their head. They will not take pills. They will not jump off a bridge, but they will put themselves in dangerous situations so that ultimately their life is at risk. And it is a passive act, but can be as detrimental as taking pills and jumping off the bridge, because these individuals end up dead. So those are the three that we see most commonly. Again, post-traumatic stress, but that is falling under the umbrella of anxiety.
Wow. Yeah.
Interesting point.
And when I said trending, I meant that in a clinical way, because people say trending, isn't that something that's happy? I mean, that's good.
Yeah.
But it can be used in a clinical way, like you said.
Yes.
Thanks for that. I didn't, Colonel, I'm sorry, I didn't mean to interrupt you.
Well, you know what, and going back and rewinding back to the subject of PTSD and being a clinician, we look at this last 2 years, especially in the hot years, the 1.5 years of the pandemic. Healthcare workers, the people that working in the ICUs and we spun up. We had pandemic wards, and we saw like 1.3 million people in the United States officially succumb from COVID, not counting probably maybe 300,000 to 400,000 people that died at home or it didn't get counted. And then but those if you made it to the hospitals, we saw those nurses, technicians, and everybody else seeing massive amounts of death and suffering, and had to listen to the stories as well. Can you give me the vaccine now as I'm wheeling you into the ICU to put you on a ventilator? And you have to tell that client or that patient saying, sorry, but it's too late. And I'll tell your loved ones, you know, that you love them, and but this is probably the last time you're ever going to see them alive, you know, and so that's a PTSD piece also. And then so you have a lot of clinicians now working and actually a lot of them have left the professions because they saw so much death. And I think that's an untold story out there.
I would agree with you. And one of the things that I remembered in the early days of COVID, and actually the health personnel often couldn't leave work. They couldn't leave the shift. So they were there faced with that death everywhere, every day, but often couldn't leave. And then when they left, were fearful that they were possibly taking that COVID to their homes, to their loved ones. So many of them then isolated, even when they were not at work. And if there was something trending that is contributing to mental illness, that's not a psychological disorder, study the impact of loneliness, right? Because right now, people are believing that as a result of COVID, people have become more isolated. And given that, they've become more lonely. And a study I was listening to, I didn't actually research this myself, but I was listening to last week, talked about they now have found that loneliness is as detrimental to health as is smoking and lack of exercise. So, and the saddest piece of it, I think all of it has some emotional aspects to it, but that the greatest increase in loneliness is being seen in young children. I believe that the number was a 68% increase in loneliness that you're seeing with kids And that is directly related to the technology. These children, young adults, adolescents, they're on their phones constantly.
Mhm.
TikTok, social media. However, there's very little human interaction. And we're finding that that involvement on social media does not replace human contact.
Mhm.
And students are reporting that they feel isolated and alone. And we want to do something about that. When we want to talk about promoting wellness, we have to get our kids, we have to get off that technology.
Mhm.
Even if we think about the fact that we don't move as much, physical, we become sedentary. There are clear indicators about how that impacts our health. Again, I heard sitting is the new smoking.
Mhm.
So if you have a sedentary lifestyle, you work 8 hours a day and you're seated and you don't get up. And I think the prescription is every 20 minutes.
Yeah.
You are having negative impact on your physical health.
I wanted to bring this up, and we'll probably end up, because one of the things you want to do is tell listeners, how to have good mental health and what we
Yes.
need to do that. But before we get there, and I'll let you end on that, so people will get something out of this conversation. You heard people say, "Oh, it's just talk," But anyway, we want to offer some relief there. But I just want to go back to and Colonel Florida DeSantis, the bill that just passed about restricting transgender people.
Mhm.
And when I think about that, the people that transgender or have issues like that, when you get laws that are passed against them being themselves, you're creating some kind of mental health situation, a possible mental health situation there, because they're already going against what people might think is the grain by being what they consider being themselves. And then you have laws being legislated to restrict someone from being free or being themselves. They're creating, in my mind, in my opinion, they're creating something that could be detrimental to their mental health and other people around them.
Yes. Similar to laws that were enacted against Black people
Yes, yes.
years ago, right? And so we can't disconnect the way in which our society, the way in which our government alienates individuals for whatever agenda they may have, but the consequences occur to people on an everyday basis and makes us feel as though we are outliers, as though we don't belong, and furthers the isolation that individuals feel. Not everyone is going to go down quietly.
Mhm.
And so that's where you see then the hatred and many of those negative aspects that people act out because they feel I'm just as human as you are. But yet you're trying to take my rights. You're trying to alienate me. You're trying to discriminate and marginalize me. And people get angry about that. And we now live in a culture where increasingly people feel as though they can act on those thoughts.
Mm.
So I'll go shoot up
Yeah.
something.
I go.
So it's cyclical.
Mhm.
It is cyclical.
But you know what? I'll fast forward that same concept that Slim was talking about, the transgender issue. In reality, that really affects, when you talk about transit, a small percentage of society, but it spins up the other 99% of the vulnerable population that is weak-minded to say, hey, it's coming towards me, and they're getting they're going to turn my children into something that I don't agree with.
And it's against the law.
Yeah, and it's now it's against the law, but it spins me up. And most of them can't even find, don't even know somebody that is on the other of another persuasion, but they're spun up for an election. It always comes up on an election, and the day after the election, you won't hear anything
Mhm,
about it.
mhm.
So, and that is the other issue. If you look at issues, voter integrity laws, where we say we need to have voter ID, and we want to protect the right to vote. And this is mainly in the Confederate states. You have more, if you look at it historically and actually on paper, you have more people accusing Donald Trump of rape and sexual abuse than you found cases of people in this whole country that voted illegally.
Mhm. Mhm.
Think about that. Think about that.
Mhm.
Yeah.
I read something last week that said intelligent people are being silenced
Mhm.
so that ignorant people don't feel out of place.
Yes. Yes.
And I couldn't agree with that more.
I agree with you.
You know, it's just not logical.
Yes.
And I don't understand it, but I've had to accept that perhaps it's not to be understood.
And here I go again with another movie reference. Can't remember the title. I saw a movie a long time ago where the premise was idiots were in charge. And it was a comedy, and the decisions they were making was just as crazy, as you can want to be. But it was funny. I laughed during the whole movie. But I think about that movie now.
And how
and
art imitates life.
art imitates life, and the comment you just made about
It's true.
intelligent people being silent, because
Yeah.
intelligent people, I think they were being locked up, because if you had any kind of, to steal the movie, any kind of intelligence, they put you
Yeah.
away because it was against the law or something.
Yeah.
And the president of the United States was an idiot,
Mm.
but I hope it doesn't come down to that.
What?
You mean it hasn't?
I think we're headed down that road, and we
Yeah,
might be there already. At
I
least we
think
were
it has.
there. We were there 2 years ago.
I think so. I think so. But I'm really appreciative of this opportunity, and every opportunity I get, I try to talk about mental health, mental wellness, because it's achievable. And I'm going to leave with some things that are just common sense.
Mhm.
This is not a discussion that's going to teach anybody anything new. These are things that we know to do. So often I refer to myself just as an ambassador, because I'm not going to tell people anything that's novel. I'm not going to tell them anything that usually they don't know for themselves. The issue is that we've got to believe it and we've got to act on it. We all know years of data have told us that a minimum of exercise 3 times a week has positive health effects. But how many of us do that? And then of those who do that, how many do it as a response to a health threat? What if we were proactive about it and we never got to the threat? The same thing applies for our mental health. And so there are some very basic things that we can do that would improve our overall mental health and would avoid mental illness. One of them is to just get adequate sleep. People talk a lot about burning the midnight oil, whether you're doing it because you're working or whether you're doing it because you feel like you can't sleep, so you just scroll your phone or you watch TV. A minimum of 7 to 8 hours per day, per night, is what's necessary for good physical and good mental health. And often when people feel like physically, I just can't go to sleep, there's something about their sleep hygiene that needs some interruption. Perhaps they need to begin a routine about 8 o'clock at night or 2 to 3 hours before it's time to go to bed, that then begins to allow their body to signal to them, I'm getting ready to go to bed for the night. Removing electronics and devices from, there have been times, and I'm preaching to the choir, there have been times when I've slept with my phone in the bed. And if I wake up in the middle of the night, the first thing I do, I say I'm looking at the time. Right. And I look at the time, but then before you know it, I'm checking. Oh, a text came in. Who texted me? After, then that leads to, oh, let me just see what's happening on Facebook, and let me see. And I might even do a Bible app. That's positive. It's good for you, but it's delaying me from sleep.
Mhm.
And clearly, we know that sleep is indicated. Earlier, we talked about isolation. So another good strategy, a tip for good mental health, is that we should make social connections, especially face-to-face connections. And when we can't do that, we should make effort to talk to people. You know, there are some people who live alone, and when they go into their homes, they don't have any contact with anyone until they go out again. That's why we encourage people, make a phone call, check on somebody that you haven't seen in a while, because those conversations are very important and critical. One of the things that I became aware of on a personal level is that I often make phone calls for my church. It started during the pandemic when we wanted to reach people. And I noticed that I can call someone and leave a voicemail message, because a lot of us, myself included, if we don't know the number, we don't answer the phone. And so they didn't know my number. They wouldn't answer the phone. And I'd leave a very detailed message. On behalf of our pastor, we're calling to let you know that your church is thinking of you. Detailed message. People would call back just to be able to talk. They wouldn't have any questions. They wouldn't have any prayer requests. They wouldn't need anything. And even though all the information was left for them, they still would call back. So those social connections are important. And if we can't do them face to face, we should at least reach out to people by phone. Another strategy is for us to stay active, get moving. Even if you don't go out, walk around your house, the inside of the house or the external of the house, but get some movement in. And recently I became aware that it's not only important to get the activity done, but we also need resistance. My doctor told me, oh, you can walk all you want to, but there's some other things you need to do as you get older to maintain the strength of your muscles that involves resistance. And so people use bands, they use weights. So these are things that we have to begin to do, but it releases endorphins, it releases chemicals, releases neurotransmitters that are good for our psychological health. Another thing that we can do is appeal to our senses. When is the last time that perhaps you were in the dark, but you just relied on your hearing? Is there music? Are there sounds that are comforting to you? There are a lot of apps, many of them are free, that just have the sounds of the waves, has rain. Those are things then that appeal to our senses, our sense of smell. That's why you see an increase, the trending in diffusers, essential oils, candles. These are things that create an atmosphere of calm for us. We also suggest that people take up something that they enjoy doing, even if they only do it for 1 minute a day.
Mhm.
It doesn't take, we think that it takes, oh, I don't have time for that. If you don't have 1 minute to listen to some music or 1 minute to do something that you really enjoy, then you're too busy. You need to readjust your schedule. And the last thing that I'll leave you with, although there are many, reading a certain number of pages a day, but drink water, hydrate your body.
Mhm. Mhm.
These are all, we know this. They're all very basic things, but often we take them for granted. And we don't recognize the significance that they contribute to our overall mental health until our overall mental health is compromised. So if you do it on the front end, I think there's a saying, if you stay ready, you don't have to get ready, right? So if you use these strategies to stay well, you don't have to get well. You don't have to respond to get well. So again, I just thank you for this opportunity. I hope that someone who hears it will take to heart the things they already know, but perhaps they're not doing, and tell somebody,
Yes,
share the information.
Mhm.
indeed.
Great point. Great point.
Yep, but Dr. Duncan, thank you very much. And maybe you should create an app with your voice, because like we've always said, it's so calming. And the information you give, and somebody can put that your voice on at night and get about 7 or 8 hours of sleep.
I appreciate that. And I always laugh, because if you would have asked my husband or my daughter about how relaxing my voice was, I don't think they would say the same thing.
They
But
would
I
say the same
appreciate
thing.
it.
Yeah.
I appreciate it.
But anyway, well, we do appreciate anytime you come on. We appreciate you being one of the hosts here on Portsmouth Coffee Talk.
Again, it's my honor. Thank you
Yeah.
so much.
And we want to thank all the listeners on Facebook Live, and of course earlier on WGPL 1350 AM. And until next time, Dr. Duncan and the Colonel, do you have any last comments?
Well, Ernestine, thank you for coming on. And I just had this vision, since you're over there in the big house at Norfolk State. And I might put you on the spot, but I see a clinical psychology program over in Norfolk State, and seeing if that is a possibility in one of these years.
So I'm so happy to talk about that. For roughly about 30 years, Norfolk State Department of Psychology has been in collaboration with EVMS and ODU, and we do offer the doctoral program. And so we've done that for many years. And but we now also have the partnership for the School of Public Health.
Mhm.
And so I'm really excited about the possibilities of what could happen. We're just trying to change the narrative that our health is important
Mhm.
on an individual basis and then on a public basis. And let's just have healthier communities. So thank you so much. We are working on those things. Some of them are actually in progress, but we need to attend to them, because as you all know, the access is difficult. And many times people don't go to a doctor, don't go to a therapist, because they feel like it's so foreign to them. So if we could increase the numbers, again, my opinion, if we could increase the numbers of doctors, if we could increase the numbers of psychiatrists, psychologists, social workers, mental health professionals that look like the community that needs it, then I think we can increase the numbers who utilize it.
And Doctor, last thing, until you can get to the professionals, it also helps to talk to somebody, to
Yes,
talk to somebody you trust,
yes,
and don't hold all that in.
yes,
You talk about people that live by themselves,
yes,
and you mentioned about on the phone, but sometimes you need that face-to-face
you do.
with somebody, a family member or someone you really trust, to
You
get it
do.
out. Until you can get to the point where you can see a professional or work that out, holding that in, you could be the next mass. Well, I don't want to go there, but
It is
holding that in
detrimental.
is not good.
It is detrimental. And again,
Mhm.
I know that the time is ending, but that's a whole nother show,
Mhm.
because you said talking to somebody that you trust. And so individually, if we may not be the person that needs to talk, we need to learn how to hold confidences.
Mhm.
I know a lot of times people say, let me pray for you. And they use that to be able to tell somebody what you're going through.
Mhm.
So we have to learn on an individual basis to be repositories that hold trust, right? And that earn trust, so that people can trust that they can talk to us,
Yeah.
and that you will leave it there. You will honor
Mhm.
them to not talk about it
Right.
elsewhere.
Broken one time, and that person may never trust anybody again. They'll never,
Exactly.
even professionals.
Exactly.
Okay, well, we will end this time, and thanks everybody.
you.
Portsmouth Coffee Talk is here for our voice and community,
In our future.
and we salute you, doctor. Thank you. We appreciate
Thank you so very much.
All right.
Everybody have a great day.
Everybody have a great day. We'll see you on Thursday.